So there's been multiple prospective studies or observational research, I suppose, in terms of the effect of lowering blood pressure on dementia risk and cognitive impairment. A lot of those studies have pointed to the fact that controlling hypertension in midlife it can help reduce your risk of dementia in the future. When it comes to randomized controlled trials, there's been a number of trials which also looked at this question. However, meta-analysis of these trials to date hadn't really shown that reduction in cognitive impairment or dementia. And we were prompted to do the systematic review by the publication of the Sprint Mind and Hope 3 study. As we thought they might lend valuable insights into this question. And we wanted to see if we could put this together in a meta-analysis. So that's what prompted our systematic review. We looked at the effect of blood pressure lowering using antihypertensive medications, and the outcome was the reduction of dementia or cognitive impairment. We included trials, they had to be randomized control trials that compared blood pressure lowering using medications with a control. They had to be at least 1 year follow-up and have at least 1,000 participants. And also they had to report either dementia, cognitive impairment or cognitive decline or a change in a cognitive score. Our overall search yielded about 1,500 articles. When we whittled this down, we had about 14 trials, which we included in our qualitative review. And we included 12 trials in our actual meta-analysis. The mean age of our participants was 69 and the mean follow-up was about 49 months, just about 4 years. Our main results are that the blood pressure lowering was significantly associated with a reduction in dementia or cognitive impairment. And this worked out about 7% versus 7.5% over 4 years. And the odds ratio was 0.93. So this correlates to a 7% reduction in dementia or cognitive impairment over the 4-year period. We saw a similar result for cognitive decline, although our analysis on the effect on change in cognitive score was not significant. Probably reasons for this would be differences in scores that were used for cognitive scoring and dementia reported as an outcome in a lot of the trials. Our conclusions really are that blood pressure lowering using medications is useful for reducing your risk of dementia. I suppose at an individual level, this effect is modest, about 0.39% absolute risk reduction. However, when you think of how many people have blood pressure and how many people are living with dementia worldwide, I think the benefits at a population level are likely to be significant. At the moment, there's almost 50 million people living with dementia, and this is estimated to increase to about 135 million by 2050. We know that blood pressure is not well controlled, and I think the main take-home message from this study really is to focus on the screening, prevention and treatment of blood pressure, with the focus for our patients that if you do this, as well as reducing your risk of heart attack and stroke, it's actually good for brain health, it's good for reducing your risk of dementia going forward.